Okay. Now I know in terms of Alzheimer's, we're learning a lot more in recent years about the disease itself, but there's still a lot of gaps in what we understand. Is that true for the overlying dementia? Is there a lot of gaps in terms of what we understand causes this problem?
Yeah, so I think there's been an increase in our understanding about how vascular risk factors, for example, increase your risk of dementia and also increase the main type of dementia, which is Alzheimer's. And with Alzheimer's, there's been much work, excellent work done on understanding, buildup of proteins in the brain and how that seems to be linked to the syndrome. However, disappointingly, trials of medications to remove these proteins has not been, has not resulted in any treatment. So yes, there are still gaps to understand really, how these risk factors result in these buildup of proteins and at what stage and how to stop this process so that people can either be prevented from getting dementia or once they have it to be able to reverse that process.
Okay. And statistically, the population is aging across the world. Um, is this going to be a major public health issue with a aging population with a big percentage of baby boomers now entering their 70s and late 60s? Is dementia going to be a major health problem?
Absolutely. So the numbers of dementia, the numbers of people with dementia is going to be, increasing massively over the next couple of decades because people are living longer, which is a good thing. Life expectancy is increasing worldwide, but that does mean that the risk of dementia is increased. And especially if people are having fewer children, how are we going to continue to support the older people as they age? Dementia already costs $1 trillion a year in terms of health and social care costs, and this is only going to go up. And we need to really be planning, for prevention and also, treating people with good quality care as they get older and thinking about how to support those processes.
Okay, that's really all the questions I have. Is there anything else you want to say about dementia or the report itself?
Well, no, I just that reports such as these, I think, are incredibly important in contributing to, raising awareness about dementia as something that we all need to be talking about, thinking about, and realizing that there is a lot that we can do, and we hope to be able to do more in future.
Okay, well, thank you so much for joining me.
All right, thanks so much for having me.
All
Bye
right.
bye.